welcome. Thanks for taking the time to join me today. I'm Anita Karcz. I'm the Chief Medical Officer at the Institute for Health Metrics. And this is our third episode about social determinants of health. And I'd like to walk you through a little bit about case studies of how to identify people who have social determinants of health and needs in that regard, and then what hospitals have done in that realm, some examples of meeting those needs. So I've introduced myself, but let me introduce our organization, IHM. We're a not-for-profit organization, and we are dedicated to bringing hospitals data for improving performance and reducing disparities. Now, one of the key issues around evaluating populations for social determinants of health and needs is using data to do that. And there are many different ways that hospitals and other health organizations can do this. But I'd like to outline a few here on this slide. One is patient screening data, and some organizations do this, which is every patient who comes in has a screening questions asked of them. The good thing about this is it's very detailed, but it's labor intensive, and it only applies to the patients who actually come into the institution. EHR data is readily available, but it doesn't have all the SDoH detail that you might like. And a lot of that detail is hidden in unstructured text notes. So it's very difficult to get to. And again, it's only partially covers the community, even though it may cover the patients that are served at an institution. Now, government data, this is data that is not just census data, which comes out every 10 years, but there are government surveys that happen on a yearly basis. This is very detailed and is projected. It's very good coverage around the country, actually. It's readily available. The difficulty is it's very complex and difficult to work with. And many organizations find this really beyond their reach. So some examples and resources, and I'm not going to talk to these, but if you would like to look at the slides, these are all links where you can get additional information. So we think it's important to have data-driven processes to identify people and services that hospitals can provide. And however one does it, you need to look at this by patient and also by your catchment area, which we know may not be totally 100% congruent. You want to identify needs from there, and then you can prioritize what are the needs and prioritize initiatives that you might want to work on. And this is key because nobody can do everything. Resources are not unlimited. So focus is critically important. And the other thing that's really important also is that hospitals don't need to do all this alone, or other healthcare organizations. You can partner. And this is really where the position of a hospital and a community can be very powerful in terms of leading a coalition of partnership of organizations to partner in meeting social needs of a community to help improve health status within the community. So I want to just give you a couple of examples here. There are plenty more that I could talk about, but just some food for thought. This is a not-for-profit that buys bad debt from hospitals and forgives the debt. they only buy debt, that uncollectible medical debt, from patients who live in disadvantaged areas. And the I think the most amazing thing about the way they do this is each person whose debt is paid off then receives a letter telling them that their debt has been paid. This organization was founded several years ago by former debt collectors, and I actually had the good fortune to meet one of the founders of this organization several years ago and talk to him just about how they thought about this. And because they knew that medical debt was the leading cause of personal bankruptcy in the US, they decided this was something that they could actually do. And gradually, it took on a life of its own in terms of fundraising and expanding over time. So, an important organization, and I encourage you to look it up. And if your organization is thinking of it, has any thoughts about what you're currently doing with bad debt, this organization would be an organization to speak with. Transportation. If you live in an urban area, this may not be something you think about a lot. However, in certain areas of the country, particularly in rural areas, transportation to medical services is a huge problem. Lyft Healthcare has done a tremendous amount in partnering with healthcare organizations, also with a service called Lyft Assisted for people who need a little extra help. And if you're in a smaller community, a local cab company could be an excellent partner for this, an initiative to serve the community where perhaps the hospital helps defray some of the costs of this initiative. Housing can be a huge problem. And obviously, housing for the homeless is critically important, but also is affordable housing. And this example is a partnership with Blanchard Valley Health System in Western Ohio. They own land and they partnered with a real estate development program, a company called Penrose, that specialized in affordable housing. And their first phase of building on this campus, which is this land, which is right next to the hospital and other medical buildings, is now built and is used for senior housing. The second phase is in progress and being used for family housing. Again, a creative way that hospitals don't have to do it themselves, but can actually make change. I think one of the keys, again, is the idea of partnering and being creative. Leveraging data is very important. Don't reinvent. There are lots of good ideas out there. I haven't spoken about regulatory requirements here, but CMS and Joint Commission have all put forth requirements for reducing disparities and making this a priority. And I would urge you to share these concepts with your colleagues that I've talked about in these episodes. And we have one more episode to come. I'd invite you to also join me for that. And just a quick reminder, our mission as a not-for-profit is to help the hospitals with their mission to improve healthcare access and to reduce disparities. So thank you for taking the time to join me today. And if you have any questions or comments, please contact me. I'd love to hear from you. And thank you again for joining us.